Hi, I'm Dr. Pradeep Gadge. I am a consultant diabetologist from Mumbai. Most diabetic patients, as I see, do not take care of the feet properly, and they usually land up with bunions, corns, callosities, sometimes gangrene, sometimes amputations, and a whole lot of disability which results from these problems later. So, what is it which is so important about foot care? Obviously, foot care I have told you in the earlier videos what exactly has to be done. Now coming to footwear, it is very important what sort of footwear you are wearing, because the feet is such a wonderful architecture. Can you just imagine the sort of architecture which God has given us? Like when you are walking, for a fraction of a second, it is only one toe which lifts the entire 70, 80 or 100 kg body, or sometimes person with 130 kg. Exactly what happens in the long-standing diabetic patients. Because of the long-standing diabetes, there are some structural changes which happens in the tissues, joints, ligaments, and the shape of the feet starts changing. Because of this, pressure starts coming in abnormal areas, and these areas usually because of constant friction develops corns or callosities, or sometimes because of long-standing diabetes you develop problems with the great toe which are called as bunions. So this can lead to problems. This can lead to small non-healing ulcers which can progress to problems later, which can be leading to gangrene, cellulitis, amputations and all. So it is very important that you select footwear properly. Now always see to it that your footwear is of good quality, good fitting, and preferably buy your footwear in the evening, because a good number of diabetic patients, especially the kidney patients, will have a minimal swelling in the feet, which will lead to a little bogginess. And if you are selecting the footwear in the morning, and by evening if the footwear are becoming very tight or ill-fitting, you can end up injuring your feet. Similarly, it is very important to see to it that you don't wear hawai chappals. So preferably you should be buying your footwear during the evening, so that in case if you are a diabetic patient or a kidney patient, your feet become boggy by the evening. Footwear which you have selected starts becoming ill-fitting or very tight. So it is better to buy these footwears in the evening. Again, when it comes to patients with very bad neuropathy, see, usually in these patients the footwear tend to slip. So wearing hawai chappal in this sort of patients can be disastrous. What usually happens when you are wearing a hawai chappal? So you try to hold it between your great toe and the first finger very tightly. While doing so, actually you are holding it so tight because the footwear will slip out of those, and you tend to injure this area where there is a small ulcer which happens, and then eventually it becomes non-healing and it can become to progress to gangrene and cellulitis and multiple things. Similarly, when you are trying to hold the footwear very tightly, there is constant friction which is happening below your feet at a particular point just below the great toe, and which usually leads to corns or callosity. So these are certain things which keep happening in the patients who is wearing hawai chappal. So use footwear which have a strap from behind, which are loose footwear which cover the feet well so that there are no injuries. Again, this patient should be always wearing good quality thick cotton socks so that the problems because of this feet constant friction are lesser. The effects of direct blow of air conditioner or the air which comes from the fan is usually less. So these are certain precautions which a patient can take during buying a footwear. Similarly, you should not be buying very high heeled footwear and narrow footwear which can lead to overcrowding of the toes, which can lead to further complications, fungal infections, sweating and multiple complications between the toes, and this can be disastrous later. So these few tips can help you buy better footwear, keep your foot in a better shape and healthy condition. Thank you.